Right, in this video, we're going to be going through exercises for your hip impingement, FAI syndrome, and the labral tears that are commonly associated with people who have FAI syndrome. So if you're looking for exercises and rehab ideas, you're in the right place. Now, rehab for FAI syndrome, hip impingement, whatever you want to call it, it is often all around angles and positions. That's where we get our wins. Now, we're not going to go into the depths of what FAI is or what hip impingement is. I'll link that in this video so you can kind of watch it back because I've gone through it in a bit more detail. What we're going to be going through today is the fundamental tips, tricks and ideas and some rehab guidance from an exercise perspective. Because the thing is, for people who have FAI syndrome or labral tears as a result, that pain at the front can be really problematic. And often people who get this, they train a lot. They like to train, they like to exercise, and often it can be the thing that makes it quite debilitating in order to do so. So in order for you to be able to carry on in the gym, in order for you to be able to do the stuff that you enjoy from an exercise and a training perspective, we're going to go through some rehab exercises now and go through the kind of the tips and tricks really to navigate around it, because so much of it is around angles. You need to identify what movement patterns you can do, what movements are going to provoke it, and how to navigate around those provocative positions so we can really get the most out of your rehab. Now look, people love to deadlift, right? We all love to deadlift, but if you've got hip impingement related pain, then deadlifting can be quite tricky, but rest assured, we've got a way around it. So obviously look, when you're doing your deadlifts and you've got the barbell there and you're getting straight down to the floor, you're obviously hinging quite a lot at the hip. That can be quite problematic. With hip impingement, whatever you want to call it, FAI syndrome, bringing that hip up into flexion can often be quite painful, right? So that hip flexion type movement is often the provocative thing. Whether it's you bringing your hip up to your chest, whether it's you kind of going down in deadlift, it can be painful. So we've got to work around it. The first one is this: using an elevated position as a start point for your deadlifts could be the key. Now you can see here, look, I'm not daft. I've only put 5 kg on each side. I'm talking when I do it. I'd be mad if I started to load this all up with my normal working weight of 250 kg. That is a lie. So what you're going to do is have it at a higher position here. Because if I demonstrate this here, right, me deadlifting here and then going down to this position, if this is painful, in comparison to coming down to here, might be the difference. Because here, if I'm telling you actually I can feel it pinching, it's a bit sore when I get down here, and then bringing it back up, versus from here dropping it down to there, might be the answer. So just bringing that barbell up and dropping it down to a higher position here could be the key. Now look, don't worry about my deadlift form. This isn't deadlift 101. This is me just showing you tips and tricks for your hip impingement. That height might still not be enough, which is fine. So if you're doing this elevated height and that's still a problem, go higher. Whether you're on a squat rack and you've got the kind of clips and you could do like a rack pull, there are ways that you can still navigate to enable you to do this exercise without necessarily provoking your pain. But up here, mentally, it's great, isn't it? Because it means that you can still do the thing that you like to do. Other times, actually, it might not even be the height of the barbell. And we'll just go through this as our second exercise here. It might not necessarily be the elevation, but the position. So let's say your normal stance is fairly narrow here, right? You're narrow here, you're deadlifting and you're thinking, actually, as I'm bringing it back down, it hurts a little bit on this side. I feel like I'm having to drop my leg out to kind of compensate a little bit because it hurts. We'll just try and see, well, if you have to do a slightly different foot stance, but actually that's a lot more comfortable, you know, I'm doing that and I'm not feeling it pinch as much. Feels much more comfortable, doesn't hurt as much at the front in comparison to when I was here. Well, look, you're still on to a winner, guys. Look, don't get me wrong, right? I get that there's the perfect and the ideal, but you've got a balance here. You've got a question. Do I stop doing it completely because it hurts too much? Or do I suck it up and realise actually there's still a lot that I can do that might be a variation to what I'm used to, but it will allow me to train? I can't make that decision for you. That decision is yours. Now, for those of you who are saying, actually, I like to squat, Mehmet, squatting is my jam, and squatting is too painful. Well, this might not be exactly the same with the volume and the weights that you're doing, but it's a good starting point. Let me talk you through it. So, get a Swissball, whack the Swissball against your back and lean back into it. So we're going to try and replicate hack squat vibes with this, but get a weight. I've got a 10 kg here. Remember, not heavy for me because I am talking, but get yourself something that you can hold. Got to have strong arms for this. You've got to get your biceps, get a quick bicep pump on the go. Get your arms working, okay? Foot position, leaning back, dropping down. Now this allows you to get past your range of movement that may well have been painful before, because your body weight is leaning backwards. You're actually able to load up your legs quite nicely. It won't be the same as if you've got a barbell, and I certainly wouldn't suggest or recommend you having a barbell on your back as you do this, but it's starting to get you to load it up, down. You can even do a little pause there and come straight back up. Great exercise, nice alternative to allow you to do the exercises that we all love, squats, and without provoking it. Now, load it up, 10 kg, great. If you want to go even heavier and you've got a heavy kettlebell, you can hold that between your, kind of on your hands, hanging down, and see how it goes. But look, I'm out of breath doing that. If I was going to do that with 50 kg dumbbell, this would be a silent video, but give it a go. It shouldn't hurt, shouldn't pinch, shouldn't catch. If you find it does, modify your foot position, play around with the depth, see how it goes. But don't forget, you have to lean back. So remember I said to you, this is all about angles. It's all about angles, it's all about positions, and also just considering the fact that with FAI syndrome, that internal rotation, sometimes painful, sometimes stiff, often stiff. So we need to consider that. However, we're going to play around with this movement. So what I'm going to do here is start to introduce some unilateral load and a bit of a hip hinge that's a different one version to what we've done before. So we're going to use a moderately good weight here, and I'm going to just drop it down a crossbody and come straight back up. So I'm kind of hinging forward, I'm rotating. As I'm rotating, this is having to rotate, but within the parameters of what I've got, and then back up. One of the key pitfalls in the management of FAI is people giving hip mobility to a hip that is stiff because of skeletal and joint changes. But you also want to try and maintain what you've got. But you can do that like this without having to go into extreme ranges of movement. Now, as you're doing this, if this is too easy because it's too high up, you can bring it to the side and just slowly reach down and come straight back up. So you're kind of reaching down across your body and coming straight back up. Or if that's too hard, then you could find the bit between the chair and then you come straight back up. Right, one of the things people love to do, which is a great exercise, is a split squat, rear foot elevated split squat. But for those who have FAI syndrome, there is something to consider here. Now, when you've got a stiff hip, i.e. this is my painful hip, one of the things that we know with FAI syndrome is often the inability or a prevalence of finding it difficult to dissociate your lumbar spine, which is your lower back, and your pelvis and your hip. Often we find that there's an inability to go into like a posterior tilt. So if this is an anterior tilt, to dissociate and go into a posterior tilt. And often we see that functionally and actively with exercises. Now, the difficulty with an exercise like this one, so if we go through it now, where we're doing like a rear foot elevated split squat like this, is that this leg means that the leg here is going to maintain my pelvic position throughout, which is fine on this side. But as soon as I do it on this side here, if my hip on the left is the stiff and the sore one, as I go down, I have no capacity to go into a posterior tilt because my pelvis from the other leg is being kept in an anterior tilt position, because as one leg is behind me, there isn't any possibility that this leg can stay in an anterior tilt and the other side can go into a posterior tilt. So if I just do it properly like this, anterior tilt, maintain because of this leg here. This leg is painful as I go down into a hip flex position, but it can't dissociate away from it due to the fact that the pelvis is being maintained in that position. So all we would do is modify it, take that out of the way, but still make it challenging. So we'll just do like a split stance. This will do. Hold the weight in the opposite leg, slowly drop down, pause for difficulty, and then come straight back up and just go for control. So down, pause, and then straight back up. And you can make it more challenging depending on where you want to hold the weight or the weight itself, and just drop it down, pause, and come straight back up. So there's always a way around it. There's always a way that you can modify it or tweak it, but you have to make sure it's suitable for what you're trying to get out. So with this exercise, if you want to add in a bit of a dynamic element, you could go for this one, but just you have to make sure that the quality of movement is key. So you need to make sure that the quality of what you're doing is really well controlled. You don't want to rush it, you don't want to push it. Move on to a dynamic element. Once you feel like you've got the capacity to control the leg through range of movement and you're able to control your function. I'll talk you through it now. So let's move this out of the way first. So when we're doing these exercises, the whole principle of what we're trying to achieve here is trying to control through range of movement and build your hips tolerance to do that. Now this exercise is no different. You're going to start with one hip flexed up. You're going to take a step forward, drop into a lunge, lift the opposite leg back up, pause there, take a reverse lunge backwards, push up, hold, balance, and then repeat. Down, drive up, hold, reverse back, push back, lift that leg up. Start again with the opposite leg this time, hip flexed up, step down, flex up, reverse back to lunge, lift this one back up. That was a ropey one, I'll do that one again. Step forward, flex up, reverse back, drive up, and you need to get the hang of it. Better, like the saying goes, do as I say, not as I do. But it's a good exercise to try, see how you get on, and hopefully you'll be better than I am. So some key things to consider here. Remember, none of these are a quick fix. You've got to find what works for you. You need to understand that even on paper, people have the same problem, and for some things work, for others they don't. So you need to kind of consider what's going to be best suited for you. None of this stuff is going to be replacing what a physio can do to support you. So if you're needing support, try and get that support. Utilize this as inspiration, guidance to do some exercises, but don't let it replace rehab. It can't do that. This is just a little bit of guidance. It shouldn't replace one-to-one support. Now the key things to consider with these exercises, you don't want to be pushing too aggressively. You don't want to be kind of getting to the point where it's flaring up your pain and your symptoms. So make sure you find that balance, possibly doing them on alternate days, playing around with the dosage, playing around with the reps, see how you feel with that. And only at that point would I suggest maybe possibly kind of progressing into more difficult exercises. For someone who's got a labral tear from hip impingement, we've got early phase exercises that are published on this channel before, so you can go back and watch those. But equally, if you're finding that these are finding the sweet spot and you're doing them and they're getting easy, please comment below so I can make more content that will kind of challenge you and give you that little bit of guidance that hopefully you find useful. I do want to make more of these. I want to hear from you guys. I want to know what videos to make. So if you've got any questions, guidance, whatever you want to share with people, comment below. And hopefully some of these next videos will also help you.